we have much to celebrate. 60 years ago, our hospital was founded by Olga and Mervyn Little, and since that time, it has grown by leaps and bounds to become the major behavioral health facility in eastern Connecticut, with satellite facilities from Old Saybrook to Enfield.
Since we were last together, a lot of change has happened within Hartford Healthcare. Actually, a lot of change has happened all around us in healthcare. And one of those changes was bringing together all the behavioral health facilities within our system. And that includes Natchaug, includes Rushford, includes Institute of Living, includes Bacchus Hospital, includes the Hospital of Central Connecticut, and includes Mid-State Medical Center. So it's a rather impressive array of behavioral health programs. We were able to expand our child and adolescent unit at Natchaug in 2008. And it's significant that Natchaug expanded its unit because at the same time that Natchaug was expanding its unit, other hospitals in the state reduced the number of child and adolescent beds. 28 fewer beds today than there were in 2008. And that's a story for a different meeting and a different time for discussion. But the point I'm trying to make is that Natchaug has identified community need, responded to that need, and made it work, even sometimes against pretty significant financial adversity. And I think that talks about the character of the organization. It goes back to our roots, talks about the people that work for us, talks about our board, and it talks about Hartford Healthcare support to make the kinds of investments in behavioral health that are really very, very important. Sandy Hook was a pretty big deal in this state for lots of reasons. Not only the unbelievable tragedy of the children that were murdered that day, but also the kind of looking in the mirror that happened throughout the state. All of us looked in the mirror. We all thought about what could we have done, what's broken, what needs to be addressed. And we're going to hear more about that tonight as we go through the course of this evening. But one of the things I'm most proud about is that Hartford Healthcare really saw this as our obligation, our mission, to reach out and really communicate with all of Connecticut's residents about not just the tragedy, but about what is mental health services, why does the stigma have the impact it has?
Every story is different. Case in point, Newtown, elementary school shooting, 20 children, 6 educators, staff killed. As news reporters, this was a difficult story to gather factual information. Sensory integration disorder, Asperger's syndrome, obsessive compulsive disorder. What is this? How common or uncommon is this?
For as long as I can remember, certainly most of the last 23, 24 years that we've been having this event, we always pause to say a special thanks to those that have made really important contributions to Natchaug, to the community at large, and really help advance the cause of treating those with the problems that we're describing tonight.
So, with that being said, Margaret, Tony, Trish, Ron, and Dr. Sawicki, thank you guys very much for your continued support of Journey House and of Natchaug Hospital. And with that, here's the set.
But our relationship with Natchaug is very, very important because when life does get in the way and we can't provide all the resources to young people, and Maria talked about how important those resources are, the hospital is there, Natchaug is there with professionals such as these to provide the care that our students need.
We're talking today in our country about mental health parity and the lack of mental health parity, and in many ways the lack of equality when it comes to how those who have mental health challenges are treated by our society, by insurance companies. You know, as policymakers, we can all huddle up at the Capitol and try and make heads or tails of things on our own. But it's only through reaching out to folks like you and to committed individuals like Steve, who's dedicated his life and his career to this, that we can get the best advice we can possibly get.
I should start off by thanking my wife and my family, for without them, I'm nothing. After talking to them and getting approval, because I'll be like Jim, I decided to be on the board and try and help out as much as I could, so that we can all make a difference. And either whether it's combined as everybody trying to make a difference, or whether it's just one individual making a difference. We can all make a difference in mental health. We just have to be aware of it and maybe remove it from the closet and the stigmas that are associated with it. I think that that's what I brought to the board, was able to ask the difficult questions, or the questions that no one would raise their hands for. So I didn't have a problem being the class clown again, if you will, and ask the questions that maybe other people were afraid of. But all in all, I'm very grateful to be part of Natchaug, and the friends that I have, I'm sure I will have you forever.
The people who serve on the board embrace the core values. The staff embrace core values. I was pleased to be part of this board. It's an honor to be part of this system, and we do make a difference. Governance is a very serious business, but with people who have compassion and humor and commitment, that heavy governance becomes light and rewarding. And I thank all of you.
This evening's program covered a lot of ground, 60 years. Much to celebrate, but more important, it can be a beginning for much more. Let's each do what we can to help others see that mental illness is an illness like any other illness, and that treatment works. Thank you very much for coming.